Hi guys, I'm Dr. Dadvand. I'm a board-certified plastic surgeon here in Beverly Hills, and I focus on gynecomastia surgery. And today I want to do another case study focusing on a gynecomastia patient with grade 2 gynecomastia and large areolas. So I wanted to do this case study because it highlights a couple of things. Obviously, this patient has gynecomastia that developed during his teen years, but also he came to me because he was not happy with his areola size. And you can see here in this front photo how big his areolas are. They're about 3 times the size of a normal areola. And so what I want to show you in the oblique version is the severity of the gynecomastia. And you can see here, he's actually got all this coning here. Really, his chest shape should be more like this, with the nipple being here. And so my plan was to not only treat the gynecomastia, but then do an areola reduction to get him a normal sized areola. And one other thing you can see here on the profile is that there's a lot of puffiness under that areola. So if I took out all that gland and didn't do any areolar tightening, his areola is just going to fold on itself because it's just too much fabric, as I call it. And so doing the areola reduction not only gets him a smaller areola, but it tightens up that fabric as well. So here we are a few months later, and you can see how much improvement there is. And I'm going to zoom in on the after photo, but let me show you the before front facing photo here, just as a reminder. And I'm going to zoom out a little bit so you can see the after on the same kind of posture. And so you can see already the areola is much smaller. It's about 2.5, 3 times smaller, and that incision is healing really well. Now the incision goes just around the areola here, and even at a few months out, it looks great. It's going to continue to get really nice over the next year, year and a half. What you can't really appreciate on the front view is the amount of improvement in his contour of his chest. That's why I'm going to go to the oblique view. And so you can see here, just as a reminder, the size of his chest here, the coning there, and then if I go to the after at a few months, perfect. It goes right along the shape of his pec and no more coning. And you can see this other side too, the right side, how much better that areola looks compared to the before. It's literally 2 to 3 times smaller and just looks appropriate for his chest size. And then again, let me show you the profile again as a reminder and how that areola is kind of coning and folded out. And then on the after, it's totally deprojected. No longer is it sticking out past his chest. And this is the purpose of doing the gynecomastia, removing that tissue, but then tightening that areola so the areola doesn't fold on itself and crease on itself. And so you can see really his chest, I will say even at 3 months, looks like he never even had surgery. And that's really the goal with this surgery, is to make it as if no one ever knew you had the problem in the first place. And so had I just done the gynecomastia surgery without the areola reduction, he would not have gotten this result. By the same token, had I just done an areola reduction without treating his gynecomastia, he still wouldn't have had this natural result. So it was the meshing together of both of those things that really got him to where he is now. So the complicated thing with this surgery was not only did I have to take out all that breast tissue, but I also had to do an areola reduction as well. And in these cases, the tricky thing is if you don't know what you're doing, you can cut off the blood supply to the nipple and areola. Some surgeons who don't have a lot of experience with this will stage this in 2 operations, but if you do it properly and know exactly where your blood supply is, you can do this in 1 stage and not have issues with the areola blood flow. And so I hope this was helpful for you guys and was informative. And if you like this kind of stuff, be sure to subscribe. Till next time.